Welcome to another medicine of the week. In today's video, we are covering Trastuzumab, a monoclonal antibody essential in treating HER2-positive cancers. We'll look at its mechanism of action, indications, pharmacokinetics, common side effects, and key drug interactions. Trastuzumab is a recombinant, humanized monoclonal antibody that specifically targets the extracellular domain of the human epidermal growth factor receptor 2, which is overexpressed in some type of cancer. By binding to HER2 receptors on cancer cells, Trastuzumab blocks cell signaling pathways that promote cell growth and division. It also activates immune-mediated responses that destroy these cancer cells. This dual mechanism slows tumor growth and reduces the spread of HER2-positive cancers. Trastuzumab is primarily indicated for HER2-positive breast cancer, either early stage or metastatic. It's also used with chemotherapy for HER2-positive metastatic gastric or gastroesophageal junction cancers. This specificity for HER2-positive tumors makes Trastuzumab a targeted therapy, improving outcomes and limiting impact on non-cancerous cells. Trastuzumab is administered as either an intravenous infusion or subcutaneous injection. It has a long half-life of around 5 to 12 days, depending on the dosing schedule. This allows for dosing intervals of every 2 or 3 weeks. Trastuzumab is not metabolized by the liver cytochrome enzymes, which reduces its risk of interactions with other drugs metabolized by this pathway. Trastuzumab is generally well tolerated, but some significant side effects can occur. The most serious is cardiotoxicity. Caution should be used in treating patients with pre-existing cardiac dysfunction. Assessment of cardiac functions is necessary at the start of the therapy and every 3 months during the Trastuzumab treatment. Trastuzumab should be held when decrease in the left ventricle ejection fraction is more than 16% from baseline, or if patient develops symptoms of congestive heart failure. Other common side effects include infusion-related reactions such as fever, chills, and nausea, especially with the first dose. Rare but serious adverse effects include lung toxicity and hypersensitive reactions. Trastuzumab has minimal drug interactions as it does not depend on liver enzymes for metabolism. However, caution is advised when used with anthracyclines like doxorubicin because the combination increases the risk of cardiotoxicity. For patients receiving both, a careful assessment of a heart function is essential. Additionally, be cautious with other drugs that can affect the heart. To summarize, Trastuzumab is a monoclonal antibody that targets HER2-positive breast cancer and gastric cancer by blocking cell growth pathways and activating immune response. Cardiotoxicity is the primary side effect, especially with anthracyclines, so monitoring heart function is key. Trastuzumab has few drug interactions, but care is needed when used with cardiotoxic medication. Thank you for watching today's overview on Trastuzumab.